So there are 21 new community cases to report today. All are in the Auckland region. There is one additional case which is yet to be determined whether it is a border or a community case. So the total number of cases associated with the current outbreak is now 841, and of those, 147 are now deemed to have recovered. Ongoing investigations by our public health units, in particular Auckland Regional Public Health, has resulted in the total number of unlinked cases falling from 33 yesterday to 24 today. That work continues and the number is expected to continue to fall. Analysis of yesterday's 20 cases shows that 17 or 85% were contacts of known cases and 16 or 80% were household contacts who were already isolating. Just 4 people were potentially infectious in the community, with 8 exposure events between them. None were in essential worker workplaces, and none of these exposure events occurred after those people were asked to isolate. So thank you to them. Clearly, all the numbers are moving in the right direction, which is reassuring. We still have a number of people in hospital, with 39 cases, all in the Auckland region, still in hospital. And of these, 6 are in intensive care or high dependency units, and 4 currently require ventilation. Finally, on our vaccine rollout, this continues at pace with more than 66,000 vaccinations delivered yesterday. Over 60% of eligible New Zealanders aged 12 and over have now had their first dose, and nearly a third are fully vaccinated. It's a massive effort to all involved, and I want to thank them again, as well as, of course, everybody who has rolled up their sleeve and done their part to keep themselves and indeed the wider community safe. Finally, on the topic of vaccination, a special shout out from a mum who asked us to share a positive story about her son's Covid-19 vaccination experience. This young man, who has a health condition which makes him very anxious, was seen by a wonderful nurse who gave him his first vaccination. His mother says the nurse, whose name is Louise, and the staff, all the staff at the vaccine centre, made the experience a wonderful, relaxing one for him and helped take his anxiety away. She says their awesome and very kind approach made this such a positive experience for this young member of the disability community, and I know that positive experience is one that has been a part for many, many New Zealanders who have been vaccinated to date.
When the Delta outbreak began, we had a choice. Continue on with our plan, which was designed to very closely match our supply in New Zealand, or to stand up additional surge capacity. We chose to stand up extra capacity, and we've experienced demand at 180% of what we planned for. At our peak in recent weeks, we have been vaccinating more people per capita than countries like the UK, the US, Australia and Canada were at their peaks. However, to sustain these record high levels in the latter part of September, we needed to obtain additional supplies. This will supplement our stocks until our large shipments arrive in October. As such, the government quickly reached out to Pfizer and overseas partners to see if we could bring forward orders or purchase vaccines from other countries. These rapid negotiations have been taking place behind the scenes over the last 2 weeks. To say they have been complex would be an understatement. Without going into all the details, such arrangements require new agreements to be developed, indemnity issues to be resolved, a process to ensure existing regulatory approvals apply, and extensive multi-party negotiations, not to mention a complex logistical operation. As a result of these efforts, we are now finalising arrangements that secure additional supply in September. This will enable us to maintain our extraordinary vaccination rates throughout September until our bulk deliveries land in October. We are still waiting for final contracts to be signed, so I cannot confirm specific countries or details on quantities. They are, however, Pfizer doses, and we will share further information as soon as we are able. I'd also add that these arrangements will enable us to continue our support for our Pacific neighbours as they look to extend their vaccination programs to the 12+ age group. While we wait to share extra information, for now I have one simple message to New Zealanders. Please get vaccinated. Let's use the coming weeks to really push our vaccination rates as high as possible so we can protect our loved ones from COVID avoid having to use level 4 lockdowns in the future. Because Delta is so much more transmissible and dangerous than other forms of the virus, we have had to create a stronger alert level 2 and strengthen the rules at level 2 to take account of that. But as I said yesterday, some of these measures will also form part of our new normal. So long as we have COVID in the world and as we seek to avoid the use of lockdowns in the future, things like QR code scanning and the use of masks will be some of the ways that we can continue to keep the virus at bay. I wanted to touch on a few of the common questions and in some cases misunderstandings that have arisen since the alert level announcement yesterday. The first is a really key one, and it's on the wage subsidy. All businesses remain eligible to apply for the wage subsidy so long as any part of the country is in level 3 or 4. So that means, for instance, a business in Queenstown, which is in level 2, can still apply. You still need to meet the eligibility criteria of a 40% decline in revenue over the previous 2-week period, but I want to assure businesses that the COVID economic support stay in place as long as, for instance, Auckland is at those higher alert levels. And that in part is recognition of the fact that one part of the country being at that higher alert level can have a knock-on effect for other parts of the country. That should also take account of those in the hospitality sector who have raised concerns over whether or not some of the caps on indoor venues make it viable enough for them to operate. They will, for instance, be able to access the wage subsidy also. Second, on mask wearing. At alert level 2, you are required to wear a face covering when using public transport, airplanes, taxi or rideshare, or visiting a healthcare or aged care facility. Many of those rules are well known to people. The major change is that you must wear a mask if you are inside any retail businesses, including supermarkets, which again people have been practicing recently, but also now that you're able to travel and visit them, malls, takeaway food stores or shops. You must also wear a mask in public venues such as museums and libraries, but obviously not swimming pools, even if you're a spectator. We know there are places where it would be impractical for customers or visitors to wear a face covering, such as hospitality venues like bars and restaurants where you eat and drink, so it's not a requirement there. And also exercising with a mask can obviously be challenging, so the face covering requirement does not apply to clients in gyms either. In general, though, if you're around people you don't know, it is a good idea to wear a mask as much as possible. Another change to keep people safe at level 2 is limiting the number of people who can travel on a bus, a train or a ferry. Delta, and indeed COVID, unfortunately loves a packed bus, and we've seen that in the past with some of our cases. So we need to try and ensure we have appropriate spacing. To do that, these services won't be able to carry standing passengers. This new rule won't apply, though, to dedicated school transport services. So it's important you think ahead and plan your journey. There may not be enough seats available on the trip you would normally take, meaning that you may need to wait for the next service instead. If you normally travel at peak time, you may want to consider whether or not you alter up your journey time just to be sure. Please, so again, continue to be respectful of drivers and other public transport staff and continue to wear a face covering and keep a record of your journey. And please, do not travel if you're sick. Do get a test though. Speaking of travel, the good people of Northland have raised some queries about transiting through Auckland, which is understandable given the area is effectively cut off from the rest of the country while Auckland remains at level 4. You will have heard me say that you will be able to transit if you need to, but you'll need to travel through without stopping and with proof of where you're going to. There is not unlimited movement though. If you need to travel for work, then you will be able to transit through Auckland, and I covered that off yesterday. Similarly though, if you need to travel for personal reasons, including to attend a funeral or tangihanga, attend a wedding or a civil union, collect or accompany tupupaku or attend an education entity, you can do all of those things as well. Again, if you can bring some evidence of why, and you just make sure you keep on driving. Through Auckland, not through the checkpoints. The principle here is we want to allow those in Northland to experience level 2 the same as the rest of the country. But we do need people to play it safe and to follow the rules. The last thing we want is someone travelling to Auckland, picking up COVID and taking it back to Northland with them. We know that borders can be busy, and we anticipate there may be slightly more traffic at the boundary, although the reasons for travel out of Auckland really remain the same as they have been. Either way, though, police had planned for this. I would just remind travellers to have the appropriate travel documents on them to speed up the process. If you don't need to travel or don't have a legitimate reason to, then please don't. And finally, please, as always, be patient and be kind.